That video will be a mess. It's gonna be a mess.
Okay, it's the reveal. I messed up the camera somehow, I guess.
You messed up the whole video, man. We don't be honest.
You can start over. You can edit it. Or is it live? Or what?
Nah.
You can edit it. Very good. Let's move the table a bit.
I'm getting these things off. Yeah. So now you got it like started right where everything's already off. It's gonna be a weird video to post.
Yes. So we're going to be removing the over ties. These little bolsters apply pressure on the areolas and nipples so that they take, so that they integrate. And we see a perfect integration of the areola and nipples.
Awesome.
Just cut off the excess suture here. So everything is nice and clean. Everything looks flat, of course, because of the pressure, but once everything heals nicely, it'll become a normal looking and feeling nipple and areola. Nice and round, very limited, very normal position for the male anatomy. Very nice. So we're going to be moving to the other side now, so we're going to switch sides. Get some light on there.
My surgeon did an awesome job.
Thank you. You did an awesome job taking it easy during your recovery.
I tried. I did it.
That's why they call it a free nipple graft. A graft is a piece of skin or other tissue that is separated from the body and then reattached in a new location. It's basically a skin graft. A piece of skin that was moved from one place to another. Since there are no blood vessels that we connected during the process, the skin sticks back on the deep layers of your skin and the dermis. New vessels grow, literally grow into the skin. Okay, a little bit of pressure, tiny drop of blood. That's a good sign that everything is nice and well nourished with a new blood flow. So you can now normal shower.
Yay!
Dab dry, don't rub. And in a couple of weeks, I'll see you again to remove all remaining sutures. The sutures around the areolas, the one in the new breast crease. These are micropore tapes, so you can remove these and change them as you please. Two little strings will be showing. They don't come out by themselves, so don't worry, you won't accidentally pull them off. That's a special technique to avoid knots at the end of the sutures so that you don't see a very evident scar at the end. We use the intradermal technique for the suturing so that the scar practically is very inconspicuous without too many ins and outs. These are tiny sutures that we can remove already because we like everything to be nice and clean, very fine suture line. You're very careful with the surgical technique, the suturing technique. This is called the intradermal suture, so you can see a knot here. And then the suture, you can't see it from here to here because it's inside, underneath the surface. So that makes the scar less visible once everything heals. So you're not doing anything else today. We're going to leave those sutures in place. We're going to place some dressings just to avoid any friction. So I do suggest you place a little gauze between the skin and the compression garment that I'm going to provide right now to avoid any friction.
Okay.
So in 2 more weeks, the skin graft will totally integrate. In the meantime, be very careful not to rub against it. We don't want you to peel off your rows and nipples.
They look great.
So everything is a success so far.
Yay. I'm so excited.
Lower the table so you can get your.
Thank you to Dr. Caloca for explaining everything, and of course for doing my surgery, guys. I'm going to post this shortly so you guys can get a chance to watch it. But I'm going to pause for a second so I can get up and get the compression top on completely. But first, honey, if you want to, when I get up, you can just come around and take a picture. Or not a picture, but a show. Because I can see it, but I can't because
Doesn't it look great, everyone?
yeah.
He no longer has boobs.
So silly. And again, Dr. Caloca in Tijuana, Mexico performed my surgery at a really good cost, and I highly recommend him, guys. I would take him any day over Kaiser for sure. No offense to Kaiser, but yeah. So pause it, honey, and we'll be back.
See you guys soon. Okay, everyone, this is the compression vest.
Which fits really good, huh? And they're hard to find to fit me just right.
And I want to show you how it looks from the side. No boobs.
Oh my God, man. But I'll be in this for 2 weeks, and then I'll come back to see Dr. Caloca Jr. to remove their final sutures. Alright, guys. Yay, I'll catch you guys in a few more days. But I'm going to post this one as soon as I get home. Alright, take care.